How do I know if my UTI is becoming antibiotic resistant? Imagine feeling like your infection just won't quit. That might be a sign your urinary tract infection is becoming resistant to antibiotics. Usually, when you get a UTI, symptoms like burning during urination, frequent urges to go, lower belly discomfort, and cloudy or foul-smelling urine start to improve within a few days of treatment. But if these signs stick around or get worse even after finishing your prescribed antibiotics, it could mean the bacteria are not responding as they should. Persistent symptoms such as ongoing burning, urgency, or pelvic pain after completing your medication are red flags. If you notice your symptoms are not improving within 2 to 3 days or are worsening, it's important to see your healthcare provider. They might check your urine again with a culture and sensitivity test, which can identify the specific bacteria causing the infection and tell us which antibiotics will work best. This is the most reliable way to confirm if your infection is resistant. Watch out for systemic signs too. If you develop a fever above 100.4 degrees Fahrenheit, chills, back pain, nausea, or vomiting, these could indicate the infection has spread to your kidneys or bloodstream. Such symptoms requiring prompt medical attention because they suggest the bacteria are not being controlled by the current treatment. People with recurrent UTIs or previous infections resistant to antibiotics are at higher risk. If you have a history of resistant infections, your doctor might take extra precautions or suggest different testing methods. Remember, stopping antibiotics early or not completing the full course can contribute to resistance, so always follow your healthcare provider's instructions. In terms of bladder health, untreated or resistant infections can cause ongoing inflammation, which might lead to discomfort or complications. Sometimes, persistent infections can even mimic symptoms of bladder cancer, making it harder to diagnose correctly. That's why timely treatment and proper testing are so important. In summary, if your symptoms stick around or worsen after treatment, especially if you develop fever or chills, it's a sign you should see your doctor. They can perform tests to confirm whether the bacteria are resistant and adjust your treatment accordingly. Always consult a healthcare professional for personalized advice, as each case can be different. Protecting your bladder health depends on catching these signs early and getting the right care.